Hi guys, thanks for joining me. Today I want to talk a little bit about kidney disease. I'm primarily going to focus on chronic kidney disease, but I do want to mention that we do also see acute kidney disease. Chronic kidney disease is far more common in cats than in dogs, but we do see it in dogs as well. Acute kidney disease happens in both species. And really, what the difference is between acute and chronic kidney disease is the amount of time that the injury happened over. So, with acute disease, we tend to think of damage, irritation, something that's occurred to the kidney within a matter of days, not really weeks, something that's happened that really has not given the kidney time to adapt. Those patients are much more sick. They tend to come in very suddenly, they get sick very suddenly, their owners notice that they're not feeling well, they're down, they're quiet, they're lethargic, they're vomiting, they could be having diarrhea, and it tended to be a much shorter transition from being normal to abnormal. Chronic kidney disease, on the other hand, is disease that happens usually about a month or longer, and that damage is a lot slower in onset, and so those patients don't tend to get sick until their kidney values really reach a level that they can't compensate for. Those patients have a lot of the same clinical signs that those patients with acute disease have, but it's more insidious, meaning it starts over a longer period of time. So it may be that they're reluctant to eat breakfast, one day, the next day they may be feeling a bit better, and then it's just a gradual change or a gradual weight loss. In those patients, surprisingly, we tend to see that they can tolerate much higher kidney values than they would be able to if the injury happened acutely. And again, that really goes back to the kidney's ability to be able to compensate and the body's ability to be able to compensate. If you give the kidneys enough time to really adapt to a change or a dysfunction or a damage, really those patients aren't going to feel quite as sick for a while. Typically with acute kidney disease, those patients really need to be hospitalized. What we're really trying to do with acute kidney disease is to stop whatever the damage is if we can identify it. So whether that be bacterial infection, whether that be a medication, try to take that patient away from whatever caused the kidney damage and then support the body until hopefully the kidneys can repair themselves and that patient can go back to being as close to normal as possible. Some of those patients, unfortunately, even if they're able to recover, their kidneys have been damaged, and that damage, depending on how significant it is, can go on to them having symptoms and manifestations of chronic disease. Now, with chronic disease, again, those patients typically have adapted. So if they come into the hospital and they're not feeling well, we have to try to figure out, is this just their kidney disease that has progressed to the point that they can no longer compensate? Or did something acutely happen that we can hopefully address, reverse, and see if their kidneys can improve? Typically for chronic disease, however, we're not expecting that their kidneys are going to get back to normal. And those patients, we're usually monitoring and treating them over a long period of time. Unfortunately, there's not a treatment that's going to repair the kidney. So really what we're left with is, can we slow things down? Can we make the patient feel better? Is there anything we can do to improve quality of life? We're not usually looking to repair the kidneys because we just can't, unless again there was something acute that we can address and get things under control. The diagnosis of kidney disease tends to go with blood work. And there's two major kidney values that we look at with the blood work. One's called BUN, and that's blood urea nitrogen. And that actually tends to come from liver metabolism and has a lot to do with what you eat. And the kidney, although we call it a kidney value, they're not actually made in the kidney. So the kidneys have to get rid of it, but they're made elsewhere in the body. The other kidney value, called creatinine, is actually a byproduct of creatine muscle breakdown. And so again, another component that's made in the body that the kidneys have to get rid of. And if the kidneys are damaged and not working properly, those two products are going to start to build up in the bloodstream. Now, the unfortunate part is by the time the BUN and the creatinine go up, we've already lost 75% of kidney function. So unfortunately, by the time we diagnose a lot of these patients, it's already fairly late. And again, if you're thinking more chronic disease where their symptoms have been going on for a period of time, or their kidney values have been elevated for a period of time, we're not really looking at getting that back. There is a newer test called the SDMA that's actually made everywhere in the body, and again, the kidneys have to get rid of it, but it's less impacted by muscle mass, it's less impacted by what you eat, and it's supposed to give us an idea about whether or not there's kidney damage before the BUN and the creatinine go up. So it's a little bit variable in how efficacious it is and when we actually see it go up, but that is something else that we'll look at. The other thing that we can look at is the urine. So usually the kidneys will start to lose the ability to concentrate urine. And if you think about it, your body wants to retain water. And so your kidneys are going to work really hard to retain water so that you don't get dehydrated. The kidneys lose that function at about 66 or 2/3 kidney damage. So that's something we can look at as well to say, hey, do we think that there's kidney insufficiency happening, and can we do something to address that? There's a number of other things that can go up with the kidneys, but again, most of them are relating to the kidney not working properly and having difficulty getting rid of some of those products. So that's why we recommend doing blood work fairly regularly. I usually recommend at least twice a year. Most of the patients that I'm seeing are pretty sick, and so I often recommend blood work more often than that. Sometimes it's every couple of weeks, sometimes it's every 3 to 4 months, but we really want to make sure that we're monitoring normal pets for any changes so that we hopefully can identify it sooner. And then also, if we do see it, we want to try to implement treatment as soon as possible. Typically beyond hospital setting. So hospital setting is really just supportive care, treating for the treatable if there's some sort of infection, flushing the body out if there was some sort of toxin, really just supporting clinical signs. Whereas the treatment for chronic disease is to decrease the amount of work that the kidneys have to do. So if we can't fix the function that's been lost, can we help the patient feel better? And typically that's going to be in the form of diet. So low protein kidney diet is going to be the first and foremost important part of treatment. There's also other supportive things that we can do. There's certain products on the market that can help improve different products like phosphorus, if that's going up in the bloodstream, can help correct our potassium. There's even some probiotics that kind of work to trap toxins in the gut before the kidneys have to see them to get rid of them. And then there's all sorts of supportive things. So fluids underneath the skin sometimes can be helpful. It's important to remember though that you're only going to be able to give so much underneath the skin. The subcutaneous tissue, the tissue underneath the skin, only can take in so much fluids at a time, and so often you can't really give enough, but it is something that can help. And then things like anti-nausea medications, that sort of thing. So that's kind of the general overview. I didn't go much into looking at ultrasounds and all of those other things that we can use to try to get some information about the kidneys, because that gets a bit detailed, but really our diagnosis tends to come mostly with blood work and urine tests, and things like ultrasounds are really helping to look for clues as far as can we identify maybe what caused it. So again, I hope you enjoyed this video. Let me know if you have any questions, and again, follow me, subscribe if you like this video, and I'll keep putting more videos out for you. Thanks.